My name is Dr. Edan Shapiro, and I'm a urologist in Fayetteville with Georgia Urology. I'm originally from St. Louis, Missouri. I went to college in Philadelphia, and I did my medical school and urology training in New York City before moving down to Georgia with my family. So I trained at Columbia University in New York City. It was a 6-year residency in general urology. And then after coming down to join Georgia Urology, I continued learning from some of my mentors who helped me focus on voiding dysfunction, which is one of my specialties that I currently practice. One of the things that attracted me most to urology is the combination of being able to treat patients both with medicines as well as surgical procedures. And I really just enjoyed the fact that you can often help patients with something minor, and patients are very appreciative, and it feels good to make a tremendous impact on someone's life in doing that. Another thing is that you often get the opportunity to follow patients over time and have a relationship with them, which is very unique in surgical fields. And I would say that would be the other reason why I really liked urology. So I practice general urology. I think one of my particular interests is in voiding dysfunction, both with men and women, whether it is with incontinence or overactive bladder or just any bladder-based symptoms. That's one of my focuses that I've practiced on in my field. One of the things that really interests me on women's health as it pertains to urology is the fact that this is a population of patients who oftentimes are frustrated because they're not able to get the help that they want, and they don't even know that there are answers out there, solutions for their issues. And I think it's rewarding as a provider to be able to have a patient and be able to address something that may be impacting their quality of life, and something, especially with educating them about their own health and helping them to an answer so that they can improve their quality of life and their day-to-day life. One of the things that my patients often, I think, will say is that I take the time to really explain what's going on to them. And I definitely want patients to know that when you come in, I'm going to first listen to what you're saying, listen to what your symptoms are, what's bothering you, what your goals are, and then really tailor a treatment for you. I don't believe in telling you what I think is best for you, but really hearing and then empowering you as a patient to know all your options, the pros and cons of each of them, and then helping empower you to make the decision that fits your life. One of the things I really like to focus on with both the men and women patients that I see is really making sure that they understand what's going on and making sure that I'm explaining it clearly and at a level that they understand, so that when they leave the office, they're fully aware of what's going on, they're fully aware of what the plan is, and that plan is tailored to what their expectations are, and there are clear steps, sometimes first step, sometimes a backup step, and sometimes even a third step, so that they are aware of all the options and that they feel empowered to make a decision that is their own and is personal and is fitting to their life.